I'm not able to hear you, Haley.
Oh, I'm so sorry. Thank you. Well, good
Sure.
afternoon, everyone. It's good to have you here. My name's Haley Troy. I'm a research coordinator here at the Center for mHealth and Social Media at UConn. And I am honored today to introduce our speaker, Dr. Saras Bellur. Dr. Bellur is an associate professor in the Department of Communication at UConn. Situated in media effects, Dr. Bellur's research focuses on understanding the psychological and effects of interactive media on key communication processes and outcomes. Dr. Bellur's work has contributed to both theoretical and empirical body of knowledge surrounding interactivity research and has focused on explication and measurement issues related to interactivity, cognitive heuristics, and user engagement. Dr. Bellur has co-developed a new theoretical framework called the Motivational Technology Model, which examines how we can harness unique affordances of new media, such as interactivity, to boost individuals' intrinsic motivation and encourage them to engage in preventive health behaviors. In this presentation, Dr. Bellur will explore ways in which we can make use of unique features of new media, such as interactivity, to boost individuals' motivation and thereby encourage them to engage in preventive health behaviors, as well as promote good health and collective well-being. So thank you again for tuning in. We ask that you please save all questions for the Q&A at the end, and I will now turn things over to Dr. Bellur.
Hello, everyone, and thank you very much. I'm really excited to be here today and to talk to you all about interactive media and how it can influence health motivations and perceptions. So my research background really is situated in media effects and mass communication, where I've examined the role of the psychology of communication technologies, emerging technologies, interactive media, and particularly the role of interactivity variable. So most of my work has focused on trying to understand how we define interactivity, how we design it, how can we measure it and study its impacts. My research has been fairly interdisciplinary, drawing from many different disciplines that are related. So, for example, I draw from theories in health communication, psychology, social influence, human-computer interaction, and computer-mediated communication, and you'll see some of those frameworks kind of coming together. So the broader question that is also kind of, guiding my research today, just in terms of a quick roadmap, I'll be talking about what is interactivity and try and define it from what we call an affordance-based approach. I'll also be talking about motivational technologies model, which is a framework that I've co-developed, which basically, again, tries to examine the role of interactivity variable and how it can be applied and studied systematically in the context of e-health and mHealth. The second part of the webinar will focus more on the power of interactive dialogue, and I'd like to discuss a couple of studies that are currently that I'm working on, that are work in progress, that look at this notion of social media comments and correction. So with that said, a lot of my research, I think, is driven by this fundamental contradiction, if you will, where you see big technology companies and their executives, painting a really positive picture and an optimistic picture of the role of technology and the services and the products that they offer. And at the same time, when you look at the scholarly debate, the debate continues in terms of, meta-analyses and review studies that have found either really small effects or weak or inconsistent effects and mixed findings. So the big question really is also like, how do we reconcile these differences? And one of the ways in which we can kind of try and approach this question is to look at the role of media, interactive media, specifically in the form of affordances, right? So what do we mean by affordances? So the affordance-based approach to understanding interactive media actually comes from ecological psychology, right? So this concept of affordances was proposed by Gibson, where he looked at affordances as this relationship, this call for action between an object and an actor. So affordances are considered as action possibilities in the realm of human-computer interaction, and affordances are things that allow individuals to engage with a particular medium. So, for instance, if we look at stairs, right? So coming from ecological psychology, anything that looks like a stair or a flight of stairs will afford climbing, the action of climbing. So if you look at a ball, for example, a ball could afford the action of kicking or throwing or catching and so on. So trying to extend that analogy over to new media, our questions have been related to wondering or exploring systematically what are the affordances that interactive media offer us. So in trying to understand that particular question, if you can imagine a new app that you've installed on your phone or a new website that you have created an account in. So what have you, whatever the context, the e-health or mHealth context, a lot of our activities are affordance driven, right? So they are based on specific actions. So what do I mean by that? So for example, if you share your run, if you share how many miles you've walked per day, if you message your coach in your fitness app, so those are examples of interactivity-based affordances. If you customize, for instance, by editing how many calories you've consumed today, if you customize by editing your health goals for the week and so on, those are examples of customization-based affordances. And then similarly, if you are able to navigate your way across a new platform or a new interface by following people, whether it could be fitness influencers, it could be watching exercise videos on these platforms and so on. Navigability, for instance, is an affordance, an important affordance. So all of these kind of point to this important takeaway here, which is that interactive media are not monolithic, right? So a lot depends on the affordances and on those action possibilities and what we do with them and how we use them. So adopting a more fine-grained approach in trying to understand and break these interactive media down to these specific qualities will really help us explore their impacts better. So moving on to the next part, I'll be talking about what's called the motivational technologies model, and basically how we take this affordance-based approach and apply it to e-health and mHealth contexts. So a lot of our work in this particular realm came out of our discussions surrounding persuasive technologies, this idea that, how can we design technologies, how can we build these affordances and action possibilities that can motivate individuals to kind of take charge of their own health, and that leading to more better preventive health behaviors. So this again is in contrast to some of the more traditional approaches in health communication campaigns, for instance, that have looked at social psychological variables, or that have looked at message design features or source features like credibility, user characteristics like individual differences in personalities and so on. But what's kind of missing in that approach is the focus on technology itself, right? So this emphasis on what is it about interactive media? What is it about these unique interactive affordances that can enable people, that can have a systematic impact on people's attitudes and health behaviors and intentions. So with that in mind, you see the motivational technologies model that is presented here. So it brings together theories from psychology, self-determination theory, which I'll talk about in just a bit. And also you'll see connections to theories of behavior change, for instance, like theory of planned behavior, where you see that connection between behavioral intentions, attitudes, and actual behaviors, and so on. So the part that the theory kind of relies on to build intrinsic motivation is based on Deci and Ryan's self-determination theory. So the theory has been a very powerful framework that has tried to explain this big, larger question of what motivates people to achieve their goals. And they talk about a continuum, self-determination continuum, if you will, that can range from amotivation to more extrinsic motivation, where people are driven by external rewards, in external incentives, external forces, versus some of the more intrinsic motivation factors where individuals kind of engage in these activities for its own sake, right? So they see an inherent value in performing certain behaviors. There is an inherent curiosity that is tied to more sustained and long-term effects of motivation. So intrinsic motivation has three main components, which is competence, relatedness, and autonomy. Right. So what the motivational technology framework model does is to kind of build a bridge together between the technological affordances and these psychological correlates that are tied to intrinsic motivation. So, for instance, the navigability part as an affordance, can that lead to greater competence if you're able to explore your mediated environment, right? So as I mentioned, it could be a new app that you've downloaded, or it could be a new interface or an online community board that you've joined. So ease of use, your competence, your skill levels, all of those aspects that are part of the design of the interactive media, that are part of the navigability affordance, if they foster a greater sense of competence, that'll then lead to more positive engagement, right? So another example is with interactivity and how interactivity can be used to encourage or foster relatedness as a psychological correlate. So if you're able to connect with a network, with a community of individuals who may be sharing a similar health concern or similar health goals, and if you're able to contact your coach or your physician through these interfaces, then greater interactivity and message exchanges can then lead to greater relatedness, which then taps into intrinsic motivation. Similarly, customization is another big aspect of interactive media, where we see that individuals like to customize pretty much everything that we do, right? So we like to organize it by the people we like to follow, or block certain individuals, or build in aspects that reflect a sense of who we are, right? So our sense of identity, our sense of autonomy is really closely tied to how we customize these interactive interfaces. So all of these factors lead into this intrinsic motivation aspect that builds on to more positive attitudes and behavioral intentions. So what I'll do right now is kind of, go through specific aspects of studies that have kind of added some empirical evidence to these claims. So this particular survey, for instance, looked at mHealth app users and asked them questions about perceptions of interactivity, and it was trying to explore if that is connected to more positive attitudes towards the mHealth apps that they use and towards behavioral intentions. And as you can see, these are quick snapshots, but the findings did show that perceptions of interactivity, if users think that an app is interactive, that it allows them to do a lot of different things, that it allows for this back and forth connection and so on, then that can in turn not only have a direct effect on their attitudes towards the health app and their behavioral intentions, but this path is, more importantly, mediated through that notion of autonomy or autonomous regulation. So we measured in this particular instant, autonomous regulation was tapped through items such as, I enjoy using health apps, or it's fun to use health apps, or I think it's important to track my health with phone apps, and so on. So going back to that notion of self-determination and encouraging people to kind of build their intrinsic motivation to these apps. So another study, again, found similar evidence for this autonomy feature, but they did it in a very interesting way. This was a content analysis of user profiles on the Body Space app. And they again found that for users who used these unique aspects on this platform that allowed them to think about who they are, right? So the About Me section, or talking about why they started working out or why they love this program, and even actively choosing what kinds of workouts that they would like to pursue and so on, in turn was tied to actual more physical activity, the number of hours that they spent doing cardio exercises, for instance, and even the total weight lifted. So very interesting connections that show that these features, these design features, these interactive features on these apps and services are having these psychologically salient outcomes that then determine people's attitudes and behavioral intentions and behaviors. The same study also found support for the navigability and competence link through the ease with which people could upload photos, right? So imagine, again, the kind of skill involved, the navigability and the competence involved when you're able to upload your pictures, whether it's your progress gallery and so on. So, and they interestingly found that being able to engage in these affordances, these navigability affordances, resulted in these profiles when the data was looked at, that they were lifting more weights, and this was true also more so for males. So you see an interesting gender variable also coming into play here. So moving on to relatedness, we talked about autonomy, we talked about competence. Relatedness is another key criteria when we are trying to understand those paths of the motivational technologies model. So this particular study was done on an app called the Odonto app. This allowed students to connect with others, with other classmates and other instructors. This was done in Ecuador during the COVID-19 pandemic, so definitely has implications for online learning and pandemic pedagogy here. And they found that this perceived relatedness, right? So this ability to connect with others, this ability to, find your teams and look at activities and connect with your cohort, all of these features, interactive features, fostered greater sense of relatedness. And you see that path here being significant, significantly mediating the frequency of the app use itself to greater learning motivation. Another study from a slightly different demographic looked at senior citizens on Facebook. So this was a survey that looked at a national sample of senior citizens and how they use Facebook for different kinds of gratifications. And one of the things that kind of stood out in that data as well was this ability to comment, this ability to reply to users on their Facebook posts, on their Facebook pictures and so on, fostered a greater sense of relatedness and enjoyment among senior citizens. And you can also kind of see that reflected in other activities that they pursued, right? Like commenting on others' posts, uploading new photos, chatting with others, and so on. So all of these studies are basically showing us the power, they're kind of adding evidence to this notion that interactive dialogue and interactive media that allow users to kind of connect with one another can have other important downstream effects. So that basically brings us to the second part of the webinar here, where we'll be looking at the power of interactive dialogue through what is called message-based interactivity, right? So we'll basically look at the theory behind it, the concept of message-based interactivity itself, and then I'll talk about some of the more recent projects that are looking at message-based interactivity and how it can be used as a force to not only promote better health, but also to kind of handle some of the pressing problems right now, especially with respect to health misinformation. So this notion of dialogue and interactivity as conversation has been central to the field of communication for a very, very long time, right? So this idea of having a dialogue with others is something that is intuitively appealing, whether it is with other human beings or whether it is with a machine. I mean, think about all the smart assistants that we have in our homes right now. It could be Alexa, it could be Echo and whatnot, or we could be having a conversation with an online virtual agent or an online bot. So regardless of who the entities are who are involved in that exchange, the notion of having a conversation and dialogue is really important, right? And that's because it is tied to a very strong human need, which is that sense of being connected, right? So that interconnectedness that we share is a very well-documented need that drives a lot of these conversations. So message-based interactivity basically kind of taps into that particular conversational metaphor, if you will, and then it helps us examine this in the context of online media and interactive media. So it is focused on the nature of message exchanges and how information kind of flows in various realms. And again, this is not something that is new to us, right? In our everyday lives, we use several apps and services that tap into messaging, right? It could be Snapchat, it could be WhatsApp, it could be Telegram, it could be the Facebook Messenger. So in all our everyday interactions, whether it's face-to-face or mediated, having this conversation that has that key function or key feature of back and forth interaction is nothing new, right? But the question is, does that, like, tapping into that back and forth interaction, does that lead to specific kinds of effects? And how can we kind of use it for promoting better health conversations, for instance, right? So this threaded nature of message exchanges, this is just a graph that basically illustrates, again, the popularity of these messaging apps all over the world, right? So a lot of people spend many hours worldwide on these kinds of platforms. And again, it kind of shows us the practical significance, if you will, of why this is such an important aspect of interactive technologies, this ability to connect with others. So in terms of theory, the message-based interactivity feature comes from a definition, a really early definition of interactivity from Raffaelli. So Raffaelli defines it as the conditions for full interactivity are fulfilled when later states in a message sequence, and a back and forth message sequence basically, depends on the reaction in earlier transactions as well as on the content exchanged. So for instance, let's take a look at this illustration to the left. If there's a person A and person B, and they're not even talking to one another, there is not a whole lot of interactivity going on. In fact, that would be defined as being non-interactive. Whereas if person A asks a question and person B responds, then that's reactive. Right? It's not fully interactive. For an exchange to be fully interactive, we want that back and forth to kind of go on, right? So that dialogue has to be where what person A says is remembered by person B, even if it is subsequent steps later, subsequent message exchanges later, and then they're actively taking into account, they're actively listening to what is being said, and they're incorporating those elements in their responses, right? So that's kind of the definition of message-based interactivity here. And the fundamental psychological principle behind this is what's called contingency. Right? So the perception of contingency is when we feel like the person that we are talking to on the other end is actively listening to us, is being responsive, is taking into account this coherence that is part of our dialogue. That makes it interactive, right? So there is this back and forth interaction. The conversation seems like it's being held together by a thread of interconnected message exchanges. So the goal also here is to show that conversations are iterative, right? So they build up on one another. So one of the early examples, again, of a model of communication is this helical model that you see that basically shows that iterative nature, that how later conversations kind of build upon what was discussed before. So extending this to the realm of new media technologies, we have the interactivity effects model. This comes out of a larger framework called the time model here that you see. So it's a theory of interactive media effects. I'm focusing on one particular path here that focuses on this particular notion of contingency and message-based interactivity, right? So having these interactive messages, interactive message exchanges from the platform, from the technology itself, and how that can foster this sense of back and forth, this perceptual sense of contingency. And is that tied to greater user engagement with content? Does that kind of help people become more engaged with whatever content? It could be gaming content, it could be video, it could be health. So regardless of the content, this is a framework that can be broadly applied across many different contexts. And then you can see if that can lead to other downstream outcomes in terms of changes in cognition, attitudes, and behavior. So one of the examination of that particular framework and principle was done in the context of health communication. And this particular study was particularly looking at patient-centered communication, right? So if you really think about patient-physician interaction, many of us kind of expect when we go to a doctor with a health concern that apart from asking the routine task-oriented questions, right? So the diagnostic stuff, the important medical stuff, we also expect some amount of social interaction, right? So that again kind of comes from this expectation of, conversational metaphor, human-to-human conversational principles, and so on, where we know that a dialogue or a conversation to be fully interactive has to have both task-oriented focus and social-oriented focus, especially given the context here, which is healthcare, right? So this particular study looked at this kind of back and forth interaction, interactive back and forth interaction. And since the question was, can interactive media deliver these kinds of social-oriented dialogue, what we did was we created a health tool. This was like a health website, a question and answer tool that would not only ask or give information about specific task-oriented things, but it would also include these verbal back channel behaviors or responses, right? So this happens in our everyday life when we are talking to someone. One way in which the other person can show us that they're listening to us actively is to say things like, okay, yeah, I get it. Okay, come on. All right, tell me more, right? So these kinds of verbal back channel behaviors have been shown to increase greater rapport, greater involvement, and more positive affiliative behaviors in interpersonal communication. So we were trying to examine this in the context of health apps or health tools that were situated in this particular health context. So what this particular study did, which was called Talking Health with a Machine, was basically trying to see if this combination of high back and forth, high interactive exchanges, along with these kinds of verbal back channel behaviors, if they can, what was labeled as the tone of conversation, if that can lead to more positive attitudes and behavioral intentions. So I just have a few examples here of how those different conditions looked so that you get an idea of how this was operationalized at the level of interactivity on a website tool, right, on a web-based tool. So this was a low interactivity condition where the system would ask questions. So this was geared toward a college student population, and college students were basically being asked about their different kinds of health behaviors, right? Physical activity, diet, nutrition, and so on. So, a system would ask them a question, how often do you eat food that's high in fat, for instance? And the students would have to pick from one of these responses. And then based on that, it would give them a tailored response, right? So there's not a whole lot of back and forth, right? The system is asking a question, the user responds, and then they get a tailored response based on what it is that they chose. So there's a message recommendation that is fairly standard when we see any kind of tailored interventions. So in the medium interactivity condition, the system would also draw their attention to the particular choice that they made, right? So to kind of make that interconnectedness a little bit more apparent and transparent at a system level. So for instance, it would say, you chose this particular response. Your response was very often. And therefore, the assumption is that the message recommendation that they're getting is based on that particular choice that they made, right? So there is some contingency there, but not a whole lot. But whereas in the high interactivity condition, you see the entire thread of message exchanges. It's not just one or two responses. So participants could scroll and see the entire back and forth, the entire threadedness. And the system also very deliberately kind of included specific terms in as part of its response that showed that contingency, that showed that threadedness. So for instance, it would say, also, you said that you tend to eat high-fat food very often. So therefore, this is, again, the system establishing that it's trying to build interactive feedback. So we did these studies which varied across or the different levels of interactivity, the low, medium, and high. And we also kind of manipulated the extent to which the back and forth, the back channel behaviors were part of the dialogue or not. So interestingly, some of the findings, of course, in the interest of time, I'm presenting the highlights here. So the verbal back channel, right? So the acknowledgements that showed that the responses, even though they were coming from a system, involved these kinds of paraverbals, these kind of active acknowledgements that reduced people's sense of susceptibility to certain forms of diseases, right? So it was the exact same content, the same question and answer. The only thing that differed was whether individuals received that back and forth with the verbal back channels or not. And as you can see, with the verbal back channels, they felt less susceptible to certain kinds of health conditions. And what also emerged as a significant mediator, as you can see from the graph here, is perceived contingency. This idea that participants felt that the system was being actively monitoring what they're saying, that the system is actively taking into account what was said. And the system is basically not ignoring their input and taking that to give them more tailored and personalized recommendation, fosters greater engagement, and that in turn has all these other positive effects on how appealing they thought the website was, on the content quality, behavioral intentions, and so on. So another study also kind of looked at a similar conceptualization of message-based interactivity. And here they found that message interactivity actually contributes to greater cognitive elaboration, right? So you can see the main effect here of high message interactivity that, again, indicated the entire threadedness of the interaction with a website and how that in turn led to more positive attitudes toward an anti-smoking message that was being delivered through this particular website. And this is more true for people who exhibited low involvement in the topic to start with. So this again shows the promise of message interactivity in trying to involve others who may not be as involved in the topic, but because of the interactive nature, because of the back and forth, it might kind of bring them in and help them elaborate and think more on issues. And this can again be extended to other health contexts. I remember a couple of colleagues talking about this in the context of vaccine hesitancy, for instance, or ways in which we can combat health misinformation online by encouraging cognitive elaboration through these interactive features. So that then segues into this, the next part, where we talk about this idea of social media comments and social media corrections, if you will. So we're all familiar with what happened with the COVID-19 infodemic. The pandemic, of course, has drastically disrupted how we live, how we work, how we communicate, but it also came along with this infodemic, right? So this blend of misinformation and disinformation that basically has also deepened the divide, if you will, between those who have information and those who do not. I really liked this analogy in, I think it was an Atlantic article that talked about the internet and health information, particularly online, especially in the context of a pandemic or even otherwise, as this giant game of telephone, right? Where the message that is exchanged from one person to another gets twisted, whether it's deliberately or not. That has also raised serious health concerns, as you can see the US Surgeon General report calling health misinformation specifically as a serious threat to public health. And so what this is all really pointing to is also a greater incentive for all of us to kind of collaborate and put our heads together in addressing these issues fairly urgently. So some of the recent work that we've been looking at, and since these are work in progress, I'm talking about like really broad principles here, is basically trying to understand this mechanism of social correction and what we call is interactive social correction. So we know that social correction works. Bode and Braga have done a lot of interesting studies, and I just have one example here on the slide where they've looked at this idea of social correction. Right. So this notion that people tend to correct each other on online platforms, whether it's on Facebook or Twitter or online health message boards, Reddit, and communities. So these kind of correction experiences are varied, right? So you could be correcting other people, or you could be corrected yourself. That is, other people are correcting your beliefs or your opinion or your perceptions on things. And then there's also another interesting aspect to all of this that is unique to social media platforms, which is this idea of witnessing other people being corrected. So you may not be directly engaged in actually being corrected or correcting others, but you're still kind of passively observing what's going on, right? So this often happens in those message threads, in those comment section, where you see these interactions, these message-based interactivity kind of taking place. And they found that a lot of people kind of approve of such corrections, right? So they like to see this kind of phenomenon. It's still half of what was sampled, but people are generally open to this idea of social correction. So we know that social corrections mostly work, yes, but there are still a lot of important questions that are yet to be explored. So in what form do they work? Under what conditions do they work? So is it just the sheer presence or absence of those corrections, or the way in which these corrections are delivered, the manner in which we offer these corrections, interactively or not? So some of the larger questions we are kind of debating in this particular realm is to see how we can use interactive media and that back and forth conversation that I was talking about as a way to correct individuals. And if that will in turn influence their misperceptions on health-related behaviors and so on. So I'm very curious to hear your thoughts about these as well, and to see if this connects with anything that you have read on this particular field of social correction. So other research, we are also looking at the contrast, if you will, of different modalities, where we are looking at visual representations, political candidates, for example, who portray a particular behavior. So we were looking at this in the context of COVID-19 and mask-wearing behavior. So if prominent politicians, if you see their images on social media feeds, and most of us get our news on social media feeds, so if you see them kind of portraying these behaviors of preventive action versus not, how will that affect your perceptions or your attitudes towards mask wearing, for instance? And the contrast also, if you will, or we were trying to tease out if the user comments that come under those posts, right? So it's not just the visual images. Visual images do capture our attention. You know, we do focus a lot of our attention, especially on social media feeds that tend to be cluttered, to highly visual images. But then equally importantly, I think the social media back channeling that kind of goes on, the commentary that goes on, can also be a very powerful venue to find out what's going on. And more so when we are, examining all of this in a highly polarized online realm, right? So how can we use the power of interactive media again to kind of foster more dialogue, more deliberate dialogue, and potentially, reduce some of these threats to health misinformation? The WHO also, I remember, put out a really interesting toolkit, if you will, that talks about flattening the infodemic curve, and engaging people with interactive dialogue that can foster more elaboration, that can connect people with the right kinds of information sources, or potentially some ways in which we can try to address this huge challenge. Again, it's not an easy problem, and I recognize that there are many factors and variables that could play into it, but I'm curious to hear your thoughts and feedback on this particular topic as well. So in the end, what I would like to really focus on as takeaways is that when we look at health technologies, interactive media in particular, we cannot stop at measuring behavioral outcomes or behavioral changes alone. Okay, so and again, Klasanja and colleagues here, really talk about the importance of looking at other questions when we are trying to understand behavior change and outcome efficacy with interactive media. We should also be looking at questions, for instance, in terms of, are the systems working the way they are designed to, they were intended to? What is the overall user experience of individuals when they use these technologies? So apart from looking at health outcomes, also trying to integrate and also trying to measure and understand how users respond to these technologies and affordances is a really important part in terms of measurement and our study design approaches. So a quick recap and some takeaways here. So one of the main things is interactive media, as you can see, are not monolithic. They are not these big black boxes. What we really need to do is kind of break them down into those specific features, those unique affordances that we really care about, right? So that big question of, why do we see so much small effects or weak or inconsistent effects? Part of the answer might emerge from more nuanced, more fine-grained understanding of how interactive media can affect us, right? By looking at what is it that we do and how we use it, right? Not just, like a big monolithic use variable here. So the affordance-based approach in that sense really helps us kind of build those connections, those psychologically salient, psychologically relevant, theory-based pathways that can help us combine the tech elements, the technology elements with the psychological elements, and then examine that with social outcomes and behavioral outcomes. So the next time you encounter an interactive health app, you could potentially ask yourself, does this build relatedness? Does this build competence? Does this make me feel more autonomous? So obviously the motivational technologies model is just one framework, but it illustrates a systematic way of kind of exploring these effects. So message-based interactivity and dialogue, the power of interactive dialogue especially, I think, can offer really powerful venues that can help us understand, how to achieve some of the pro-social goals and preventive health attitudes and behaviors. And they can also kind of help us tackle some of the more pressing problems that we see today in terms of online misinformation and disinformation. Okay, so with that said, I am going to stop my talk here and open the floor up for questions. So please let me know if you have any questions. I'm happy to take them.
Great. Thank you so much, Dr. Bellur, for that amazing presentation. Everyone who is with us right now, if you'd like to pop a question into the chat, or you can feel free to unmute yourself to ask a question directly, please feel free to do so.
Maybe I'll jump in. Saras, Dave here. How are you?
Good. How are you, Dave?
Fine. I was fascinated with the links you were drawing to political communication, even where I started out. And it turns out, lo and behold, the health domain sort of collided with that 2020. And you raised some interesting points at the end about kind of this post-truth era where maybe as Cass Sunstein and others would say, we've lost our sense of shared meaning, and you've got problems with infodemics. I think that was Eva Nega's term, where she did that content analysis at Cornell. And it might have been a little shaky, but it had found, I think the White House was the primary source of misinformation under Trump. And I'm wondering where you see that heading in terms of integrity of information as it relates to the lack of content moderation, to be real trendy with Musk's takeover on Twitter, and any potential remedies to help us process that?
Yeah.
Thank you.
Yeah, it's such a huge question, and unpacking it will take several attempts and not one. There's no easy fix answer for this, unfortunately. But I think, what you alluded to in terms of, I think, content moderation, I remember, again, reading a recent article that looked at like online sanitation, like how do we approach this, and how do we kind of create these spaces that are moderated so as to, I think, ensure greater trust, greater transparency, greater safety. I think that's really where I see these conversations kind of taking us. And again, like I'm coming from my perspective here, which is to say that, yes, we can use interactive media to build more deliberative dialogue, or to engage people in more, like reasonable conversations. And to what extent is that like an empirical question? Does that stand out the test? Those are things that I think we'll have to systematically examine. But I think using interactivity affordances to kind of foster engagement in various forms, I think, is one potential way to address this, at least, one puzzle at a time.
Thank you.
I have a question that was shared. How or what interactive media strategies could reduce COVID vaccine hesitancy and fatigue?
Yeah, that's also another really great question. And again, like vaccine hesitancy has existed for a really long time. It's not anything particularly new with COVID-19. Of course, what's kind of adding to the problem is the spread of misinformation related to vaccines and other kinds of preventive health behaviors that we saw during the pandemic. So that said, there are, again, a lot of studies, as I mentioned, especially the ones on social correction, I think have shown us that when we see misinformation that is being corrected, and and when that comes from credible sources, and when you can kind of see the consensus built around certain kinds of preventive health behaviors, whether it's getting vaccinated or whether it's wearing a mask and so on, there is that potential. So I guess utilizing these technologies to kind of build that amount of consensus and that amount of transparency and engaging people in those dialogues and online spaces, I think, is one potential way to address it. But yeah, I mean, it's again, easier said than done, but there are promising studies that are looking at vaccine hesitancy in particular.
Hi, so I'll jump in. That was a really interesting presentation. Question that I have is, so I really liked your logic model, and I use those in my research as well. And I teach a course on intervention mapping and talk about behavior change taxonomies and behavior change techniques. And I'm wondering if there's a repository or whether you've seen papers that actually show like text messages or interactive messages that actually match up with particular behavior change techniques or theoretical constructs. So for example, if you want to improve self-efficacy, one way to do that is through modeling. Are there examples of messages that are based in the world of modeling? And so I wonder if there's anything about out there that kind of gives examples so that people aren't completely starting from scratch when they're developing some of these kinds of interventions.
Yeah, really great question. And again, the struggle that I have, I guess in some ways it's a good struggle, is that this literature is so divided in the sense that, it's in several different camps. So trying to look for a piece that kind of brings them together, I haven't so far, but that doesn't mean it doesn't exist. Maybe I've not looked enough. So I'm happy to look into it more and then exchange that resource with you. But yes, it would be a really good way to kind of consolidate the evidence base, if you will, on using these, text message-based applications. I've seen stuff that were really early, like back in mid-90s, that talked about tailoring interventions through text messages, but I've not seen anything that is more recent, but I could be wrong. So I'm happy to look more into it.
Yeah, and I think people, should be encouraged to share more about their interventions and maybe include appendices that have like specific examples. I think it would be really helpful, rather than staying so much into theory, is to actually show some of the more practical stuff. So this was really helpful. Thank you.
Thank you.
I have a question. Thank you for the talk, first of all. So my research is in the area of wearable technology and SDT, actually. And one of the things I run into is that whereas I work for a small business, our business can create an app. Our business cannot create a wearable. So we're always running into these technologies that are made by somebody else, and they change so rapidly that it's hard to keep up. In fact, I'm writing a grant, trying to even figure out what device to choose that's going to probably not even be relevant by the time we do the intervention is a challenge. So I'm just wondering what your thoughts are on trying to use some of these technologies that are established by companies. And what's going into the technology is completely a black box because it's proprietary.
Yeah, no, I completely understand, empathize where you come from. And this is definitely a challenge for, I think, anybody who's working with emerging technologies, because as you mentioned, they change so frequently. And often there are, they're hidden behind these black boxes that we don't really know what's kind of going on. I think one solution, potentially that you could kind of approach this problem with is to look at specific variables of interest, right? So if you're looking at interactivity, regardless of what the platform is, that how it's likely to change, the principle is what is still going to be the same, right? So the affordance that you're interested in, the feature that you're interested in, is still likely to be similar. So focusing more on those particular variables that you're interested in, and not so much on the platform, which could be very different, 3 months down the line or a year down the line, could be one potential way to approach it. But yes, I do see the struggles of doing studies with very limited resources in terms of the technologies themselves or the artifacts themselves. So I think adopting a more variable-centered approach could help us circumvent some of those issues, but not all.
Thank you.
I have another question that was sent over. How can you use interactive media simultaneously to engage the audience and assess content performance in terms of attitude and belief change?
Yeah, that again is a really interesting question. And very often what we do when we measure attitudes and engagement in our studies is to measure those separately, like their engagement with just the interface itself, right? If it's, for example, a gaming interface, or if it's an app that they're using. So the attitudes towards the interface and their interactions with it is measured separately from their attitude towards the content itself and what they kind of learn from it or take away from it. Because very often we cannot kind of assume that just because they have positive attitudes towards the interface, that will somehow translate to more positive attitude towards the content themselves. So at a measurement level, trying to measure those separately and then seeing, what is being impacted or not is one way to kind of tease that out. And also to include other ways of, capturing that information. So, a self-report could give you some of the attitudinal measures, observing them while they are, engaging with these interactions in a particular lab, where you can look at other kinds of engagement, whether it's facial expressions or, their physiological responses. So perhaps triangulating data from different kinds of methodological approaches is another way to kind of get at engagement from a more comprehensive framework. There's another study that I know I did not include here, but there are more recent pieces that have looked at this engagement variable more closely, and they've looked at physical actual interaction, they've looked at psychological immersion, they've looked at engagement in terms of outreach, like how do I share this with others, how do I talk about this interactive media and kind of spread the word. So there's a typology specifically for smartphones and wearables and interactive media that kind of breaks that engagement question down. So again, I'm happy to share that resource with you after the talk, and maybe that'll give you additional ideas as well on how to approach the engagement question here.
Great. I think you spoke to this a little bit, Dr. Bellur, but there was another question in the chat mentioning the links media interactivity with self-determination theory, construct of motivation. In SDT, there typically is an assessment of whether those autonomy, competence, and relatedness needs are being met.
Mm-hmm.
People can have different levels of needs. So how might you consider this in your work?
Yeah, no, that's a great point. And again, people vary on those needs, over time, over different contexts. So we do measure them through, the scales that have been used in these studies. So you do see that variance that is being captured. I think the interesting part, which again, I'm not sure if I'm interpreting the question here correctly, so please correct me if I'm not, is to see if those needs, that the autonomy needs, competence, and related needs, instead of just assuming that they've been met, it would be a good idea to also ask participants after their interaction with these technologies to see if they were actually met. I've seen the uses and gratifications framework, for example, do this to some extent, where they're not only looking at uses and gratifications that were sought by individuals before engaging with media, but if those gratifications were actually obtained. So at a measurement level, again, looking at gratifications of self-determination variables, if those were actually obtained, if they were fulfilled, would be a nice addition. Thank you. That's a great comment.
Great. We have another question in the chat. If you want to convey multiple pieces of health information in a text message intervention, what are your thoughts on balancing the value of making it more interactive with not requiring responses from the recipient so that you can deliver as much content as possible?
Yeah, it's again, studies in, I think, human-computer interaction realm have looked at this, right? So, some studies in the health context have also looked at, how often can we bug people, or send these repeated messages again and again? At what point is there a threshold where it becomes too annoying or too interruptive or too disruptive? So that again is an open question, right? So what do you include and how do you engage? So what a lot of studies have done is kind of use the text messaging applications and services for like initial foot in the door, if you will, where you give them the basic information, and then that text message can contain a link that will take them to a web portal or to another service online or a community online that they could potentially engage in more interactive dialogue. So you can basically stagger it based on what user requirements are and what user needs are. And having an idea of, again, what those expectations are from your participant pool will also be a good way to tackle it, right? So are they okay with receiving X number of messages in a day, or would they prefer like a digest that gives them the key highlights and summaries, and so on. So I think it's Jessica Willoughby, I'll have to look this up. They've done studies in the context of interactive text messages and the frequency of messages being sent. But there are studies out there that have looked at this in a more systematic fashion.
Great, thank you. Another question that came in, are we allowed to provide the resource material from the presentation? So if you were willing to share the slides, Dr. Bellur, could attach that to the webpage, our webpage, which I'm going to send in the chat now.
Sure, happy to do that, yeah.
We do have a few minutes left, probably enough for one more question. If anyone would like to unmute or pop it in the chat, please feel free to do so.
It's added to the Q&A, so I'll just say it out loud. So one of the big challenges in terms of interaction is like you're working with people who are communicators. The implementation doesn't always translate well to the research and backwards. So in terms of message-based interactivity, are there KPIs, key performance areas that provide timely feedback to give you a sense that you're on the right path? So is there, like, have you done analyses to estimate like how well certain engagement measures predict these higher level changes in terms of attitudes, belief change, intentions, and behavior? Thanks.
Yeah, no, that's again a really great comment. Most of our studies have looked at just the perceptual level right now, right? So we're looking at attitudes, we're looking at behavioral intentions, but not actual behaviors or as you were talking about KPIs. But I think that would be a great venue to kind of push the boundary in terms of seeing those changes reflected at a deeper level. Yeah.
Great. Another question in the chat. Are there good companies that have interactive text messaging that you know of? We know of Mosio, but are there others?
I mean, I use the standard ones that I think most people tend to use. I'm thinking if there is, I know if you're interested in message exchanges with virtual agents and health bots, Replica is a platform that I've heard a lot of people use. Or if you're trying to create like an online chat-based forum or dialogue, I think it's with replica.ai. Off the top of my head, like I know a lot of people have studied regular text messaging platforms because, it speaks to greater generalizability. These are the platforms that most people use, or, across cross-cultural contexts, you're looking at text messaging features that are popular worldwide, like WhatsApp, and so on. Beyond that, I can't think of anything off the top of my head. But again, if I think of anything, I'll put it on the shared slide deck of slides, and potentially that'll answer some of the questions.
Great, thank you. So I see that we are running out of time. Thank you so much to everyone for the wonderful questions. I have popped Dr. Bellur's email into the chat, so please, if you have any other questions, feel free to reach out to her directly. But otherwise, I hope you have a great rest of your day. Take care.
Thank you all again so much.